just to give you a quick introduction to this briefing. Neil Woolman, who I believe had to go to another meeting with, is he here? Are you back there, Neil? Neil's all the way in the back, is my co-director. And so we work together, and Bobby Vassar is on our board of directors, as are many others. So these are our briefing sponsors. Just to mention briefly, because I'm up here and nobody else is, that the National Prevention Science Coalition is designed to prevent social ills and promote well-being by translating scientific knowledge into effective and sustainable practices and policies. That is pretty much our mission statement, and we are a vehicle to transferring information and educating public and private sectors. This wheel is our translational spectrum that shows how we take science all the way to policy. In addition, we have several sponsors for this briefing. The American Academy of Pediatrics, and I want to thank them heartily, especially for the cookies and the drinks in the background, in the back room. So we thank them very much for their sponsorship and their substantial presence here. We also are sponsored by the American Board of Pediatrics, the Coalition for the Promotion of Behavioral Health, which David Hawkins leads, and he'll be speaking in a moment, the American Academy of Family Physicians, the American Academy of Social Work and Social Welfare, the Mental Health America, the National Association of County Behavioral Health and Developmental Disability Directors, and the National Association for Rural Mental Health are all sponsors. Our legislative cohorts are Senator Patty Murray and Senator Lamar Alexander. The message here is that there is a science to prevention. People always ask me, and especially in the legislative meetings that we've been going to in the last 2 days, what is prevention science? Prevention science, according to the Institute of Medicine and a number of other high-powered agencies and societies and so forth, prevention science is among the most rigorously proven sciences that are there for helping people with social, mental, educational, and medical problems. So it's a very significant science that we should all know more about, given its implications. A report also by the relevant to today's briefing, by the National Institute for Children's Health Quality and the Einhorn Family Charitable Trust highlights the importance of fostering socio-emotional development in children and the opportunity to do so in the context of pediatric well-visit care. One example of this approach is called SEEK, developed at the University of Maryland School of Medicine, that many of you may know about, that trains primary care professionals to help address common problems in children and adolescents, and it supports parenting for their child's health and development and safety. The results are very significant in terms of decreases in child abuse and neglect, according to 2 very large federally funded studies. And here's a website if anybody's interested in seeing more. Housekeeping. I'm in charge of housekeeping. There's a sign-in sheet. Please be sure to sign in. There are also handouts that you received, I hope, when you came in the door. The speakers will each have 20 minutes. There's a little bit of variability in that. Some only have 10, some only have 5. But we're going to keep careful track. And we've asked the speakers to look at us so that we can stick our hands up and try not to be too obnoxious about it. But we just don't want to run out of time, and we're hoping for significant discussion at the end. And we also have asked that you complete an anonymous evaluation so that we can rate ourselves and determine how we can better do these briefings. So we really value any criticism or comments that you might have.